Hello, this is Dr. Aparicio. I'm very honored to introduce you the drilling sequence of the new Straumann Zygomatic implant portfolio. And first of all, I would like to introduce you the model we are using for this hands-on practice. So this is a model of an extremely resolved maxilla. This is the patient profile. The anatomy is more pronounced in this side, whereas on the left side is more flat. I said the word flat. This means that on the left side we are going to use the flat ZAGA design, whereas on the right side, since we are going to take profit of this small remain of bone, we will make round perforation. Our osteotomy is going to be circular, so we are going to use the Straumann ZAGA round implant on the right side. We are going to start, as I said, placing a round implant on the distal second premolar. And because for this hands-on we are just placing two implants, two zygomatic implants. And as you may see, I'm pointing you see, now we have the drill which is appearing up there. So now we are drilling back and forward, and the drill is going to drill on the back movement, not on the forward, but on the back movement. We take special care not to drill into the sinus. In other words, we take special care to preserve sinus lining and, if possible, to preserve some bone. You see, I'm drilling when I go back, not forward but back. Make a little bit more room. We shouldn't be in a hurry. It's going to be just one chance. And now, little by little, the tip of my drill is reaching the cross I made, so I don't get loose. And I like to get the cross, the middle of the cross, with the middle of the drill, in order to be sure I will have enough bone the whole drill is supported by the osteotomy, and we made a nice notch. So we have a hole, a tunnel here, and then we have not enough bone to have a roof on the tunnel there, but we made a notch on the end. And this notch is intended to stabilize our next drill, which is today is going to be a 2.9 drill. But this is a big advantage. We have just two drills. Now you see the drill should flow. You shouldn't feel any difficulty in sliding the drill. So the drill goes in, out, very smooth. Every 4 seconds you take out the drill for irrigation to occur, because it is quite difficult to hold the drill there. You don't want the bone to be hot there. So 4 seconds, out, 1, 2, 3, 4, out for irrigation, 1, 2, 3, 4, out for irrigation, 1, 2, 3, 4, out for irrigation, 1, 2, 3, 4, 5, out for irrigation. You may observe my thumb is making the pressure, my right hand is maintaining the direction. Direction is fundamental. You shouldn't change direction. So pressure is with my left thumb, 1, 2, 3, 4. Direction is with the right hand. Always use. You see, now this is a critical moment. We see the chips getting out on the other side. So now we have to control our force in order not to damage the skin. Okay, we are on the other side. Pay attention to the direction when getting out also, in order not to destroy this amount of bone. So now our next step is going to be to measure how long is going to be our implant, how long has been our perforation. So we will introduce this gauge until we get this part. You see, I like this kind of implant mount, which are very, very narrow. It's not going to disturb you. Of course, we change our speed. And you see now the first part of the implant is free until this upper part, which goes to 3.9. The osteotomy is very precise. I'm pushing here, but still I feel some resistance until the upper part. So now we have 50 newtons centimeter. Again, one hand is maintaining direction, the other hand is pressing, and both hands have to be supported in hard tissue. No matter this is a plastic model, we have to use it as if a real patient situation. So you see, very nice. So it stopped at 50 newtons. So now I'm going to use the hand wrench in order to complete implant insertion. So one thing you should pay attention is to the degree of resistance you get, because this implant design will provide you with a lot of implant stability. So you may go forward, or sometimes you may go a little bit back and then forward. Sorry for this horrible sound. Back. And I call this the dancer steps. So it's like 2 back and 3 forward. 2 back, 3 forward. So you make the bone the chip of bone will distribute okay. So in order to be a little bit quicker, I'm going only forward, but you see, okay. So now we may see that the implant is on place and the tip of the implant is showing on the other side. Okay, so now next step is going to be to estimate where this prosthetical screw is going to show up. Okay, you see this screwdriver is giving me the direction of the prosthetical screw. So now it's correct, so now we should unscrew, very easy to unscrew, and then either using a plier or your hands, you can unscrew like that. And the implant is in place now. So now would be time for abutment placing. And for this is very simple. We are going to use typical Straumann screwdriver. So now it's in place. So now we have the range on place, and then since the initial torque was even more than 50, we are going to use 35 newtons in order to secure this abutment, and that's all. So you remember this patient model, 3D model, is much more atrophied on its left side, and this is the side we are going to work now. So you probably can see transparency of the sinus, so this means it's very, very resolved. We are forced for an extra sinusal path because the amount of bone we are going to perforate here is less than 3 millimeters. So we are escaping from a late oro sinus fistula communication. So now we have the round bar. This started was again with the lateral cutting, and then we are going to drill here. So remember, we are pointing to this cross. So now you see our membrane is appearing over here. It's very nice, but we are keeping this bone integrity, so we try to make our antrostomy, which is the communication with the sinus, as far as possible for the crestal level. You see, this is the membrane, very, very nice picture. The membrane is still untouched, it's visible, but its integrity is being maintained. Try to make a path as flat as possible, and you see we are getting like a 5-6 millimeters of bone, intact bone over here, and still the membrane is not being perforated, so still we can go a little bit deeper. The deeper we go, the higher that is going to be the implant, the less compression we'll get on the soft tissue. 1, 2, 3, 4. We have already the notch. So now I can enlarge a little bit more using this lateral cutting bar. No danger now. to perforate. So we have a very smooth path for this drill, for the 2.9 drill. So 1, 2, 3, 4, out and irrigation. 1, 2, 3, 4, out and irrigation. And again, I will finish now the perforation. Four, water, 1, 2, 3, 4, water, 1, 2, implant transporter, and a flat design for this osteotomy. Let's measure first how long is this osteotomy, and again you may use your finger pressing the skin in order to note where the gauge is, or you may use the gauge hook to try to figure out how long this implant is going to measure. We already have implant mount in place. So now we are smoothly placing the implant. Again, the thumb of the left hand is pressing, the right hand is maintaining implant direction. You maybe can observe the micro threads around implant neck. Okay, let's stop it. So we'll finish by hand. Again, we have always to check the screw tightening previous to use the hand instrument. And okay, and we use the screwdriver again to check prosthetic direction. Okay, so we are going to use a little bit more like this. So now, very nice, because if we use our finger, we can see implant profile is not protruding so much against soft tissue. So now, next step, as usual, is going to be to unscrew implant mount. It's fine. We will place an abutment. So now we move like this. So you may see now implant head is on the top of the ridge. So the prosthetical direction is the ideal one. Now we will use this specially designed Zygomatic abutment that fits totally into the Straumann screwdriver. So now we are going to use the wrench in order to get stability of the abutment. So usually we are going to use 35 newtons. So now we can note that implant profile is flat. So we are diminishing the pressure against soft tissue. So this means that vessel compression it will be preserved against anoxia. So it will be more stable because it will have better conditions to stay stable. So we have escape from sinus invasion. We have escape from membrane destruction. So we are escaping from late sinus fistula. And on the other side, thanks to this unique flat design, we are trying to escape also to prevent soft tissue dehiscence, which is, as you know, one of the most common problems when you place an extramaxillary implant.